And I think sitting would be good about this point. There you go. We've been married over 50 years. We met, we lived in an apartment, went out to eat and everything. My daughter invited him to come eat one night, or one afternoon. We had a cold rain and it was yucky day. And my daughter said, "You still gotta go, you still gotta go." I said, "I got the stuff in the bag, let's go." "Well, he's not here yet." I said, "Who in the world wants to come over and visit a girl on a date with a 7-year-old daughter with them?" And so I told her, "Let's load the car and we're gonna go." And we got to the door and he was at the door. We stayed all night watching movies and we never went home without each other. This is William Timothy Johnson, 5752.
When they first came to us, and they came through Deborah and the team at the Conroe office, Mr. Johnson was a caregiver for Mrs. Johnson, who had been involved in an accident, had some physical limitations that she was dealing with. So he was acting as her caregiver, and we were able to come in and provide some respite services and supports for him along the way. Now, as time goes on, he became diagnosed with an illness and had some needs of his own, and maybe couldn't provide the same level of support that he was previously providing. So we were able to assess their needs and come in with other additional in-home services to help complete daily tasks at home and provide health maintenance services in their home for both of them. So it's just an example of how you can come in for one thing and end up needing something different, but the beauty of the Area Agency on Aging is if you get one of us, you get all of us.
Mm-hmm. She does take care of me, and I lean on her for a lot, and of course she helps me with business stuff as well as just food and travel, and she understands things that I'm starting to lose a grip on certain cognitive matters, and she helps me there. And between the two of us, we just about make a whole person, basically.
There's a number of ways that we do support caregivers. It might be through training, like helping them deal with some of the challenges they might face. Obviously respite services, so sending somebody out to the home so they can get that break or take a nap in their car or something like that. Also referral to other resources, helping them connect with other agencies that might be able to provide them assistance within the entire region.
The Area Agency on Aging has been great. They brought people in there that really helped us in doing the work, and also in just being like family. I mean, you get to know these people pretty good.
Tremendous people. I love them to death. They just the people they send out, and the people from the office. Sometimes I think it's hard to find people that are that dedicated to service.
It's important for us as the Area Agency on Aging to ensure that folks get that care for a number of reasons. Again, it aligns to our mission, which is to help people age with dignity and on their own terms. So that might mean staying home rather than having to go to a long-term care facility. And caregivers are, again, such a critical piece of that.
I think I've done just about everything, but being sick and all. I've walked with him, I've run with him, I've laughed with him. Sometimes we get mad at each other, and but it's all life. I just love him. I don't want to lose him, ever.